Health Chat is sponsored by Revitalize Orthobiologics and Wellness.
So regenerative medicine is not a new concept in the medical field. It's actually an evolving field of medicine where experts, scientists, and healthcare providers are really looking at providing options to patients that are outside of the traditional medicine route. Regenerative medicine's purpose is to help repair, rebuild, reboot parts of the body that might be damaged. So PRP actually stands for platelet-rich plasma, and it's a biological medicine that is composed from the patient's own body. The blood specifically. And it's made up of plasma, which is the liquid part of the blood, and platelets. Platelets have a strong healing property. Most of society, when they hear the word platelets, think of the ability for them to clot or to help us stop bleeding. But what they don't realize is that it's actually extremely filled with growth factor for the healing properties. So what we utilize PRP for, again, is to be able to stimulate the body's ability to heal itself. Here at Revitalize Orthobiologics and Wellness, we utilize PRP to treat an array of different things, such as musculoskeletal pain. So for example, things like back pain, osteoarthritis, your sports-like injuries, so your tendon, ligament, muscle, joint issues. There's a big wave right now going on with PRP being utilized for cosmetic purposes, such as like skin rejuvenation and hair loss as well. Things that we don't utilize PRP for, though, are patients who have like known diagnosis of avascular necrosis, which is where the bone's not getting good blood supply, acute bone fractures, people who have had hardware placed in the body, such as a joint replacement, and anybody that's been diagnosed with something like a full thickness rotator cuff tear, tendon and ligament tears. We will, as a healthcare provider, have the patient come in and be screened for appropriate use of PRP. Once the patient's determined to be an appropriate candidate, a licensed provider will draw a little sample of blood from the patient, much like when you go to get labs drawn for your doctor. We'll spin that down using what we call a centrifuge. It's a machine that'll spin at a rate appropriate depending on the areas that we're treating. What'll happen is the blood separates. So the products that we need, the plasmas, the platelets, will actually kind of float to the top while all of the remainder stuff floats to the bottom. We'll then extract, or fancy word for just pull out that stuff that we need to inject back into the patient, out into a syringe. Once we prep the patient appropriately and we're all set, the healthcare provider will then inject that product back into the patient in the areas that we're going to be treating. Most oftentimes when we're doing our injections, we'll also utilize things such as an ultrasound machine or a mobile x-ray machine, which is called a C-arm. PRP injections actually carry a very low risk. Studies have actually shown that the use, because it's derived from the patient's own blood, of the PRP carries a much lower risk of allergic reaction or side effects in comparison to traditional medicine that we use today for the same kind of ailments. Some common kind of side effects for patients, most oftentimes, they might get a little soreness at the site where we draw the blood or even the sites of injection, same with some mild bruising. But for the most part, as a healthcare provider, when patients come in, they'll be fully screened, they'll be informed of all the risks, benefits, possible side effects. That way the healthcare provider and the patient are able to come up with the best decision after the patient has been fully informed.